Welcome to this episode of Healing Horizons, where we explore the transformative journey of Ibogaine therapy in treating addiction. Today, we're focusing on methadone addiction and how Ibogaine offers a unique pathway towards recovery. With us is an expert with profound insights into this revolutionary treatment. Thank you for joining us.
Thank you for having me, Chris. I'm excited to discuss how Ibogaine therapy is making a difference, especially for those struggling with methadone addiction.
To start, could you give us an overview of methadone addiction and the challenges it presents for individuals seeking recovery?
Certainly, Chris. Methadone is a medication commonly used in the treatment of opioid addiction, particularly heroin. While it has been beneficial in reducing illicit drug use and the risks associated with it, methadone itself can become addictive. This addiction poses several challenges, as it can create a physical dependency that is hard to break. Methadone addiction can sometimes lead to a cycle where individuals remain on the medication for years, which can hinder their ability to achieve a drug-free life.
That's a significant concern. How does Ibogaine therapy play a role in overcoming these challenges?
Ibogaine is a naturally occurring psychoactive substance found in plants native to Central Africa. It's been used traditionally by indigenous communities in healing and spiritual ceremonies. In the context of addiction treatment, Ibogaine interacts with the brain in a way that can interrupt substance use disorders. It can reset the brain's addicted pathways and reduce withdrawal symptoms. This reset can be particularly effective for those looking to end their dependence on methadone.
That's fascinating. Can you delve deeper into the biochemical processes involved in how Ibogaine impacts addiction cycles?
Absolutely. Ibogaine works by targeting several receptors in the brain, including the NMDA receptor, which is involved in glutamate activity. It also interacts with opioid receptors, which are crucial in the context of methadone and other opioid dependencies. By modulating these receptors, Ibogaine can significantly alleviate withdrawal symptoms and cravings. There's also an impact on serotonin and dopamine systems, which are associated with mood regulation and addictive behaviors. The cumulative effect is a disruption of the learned behaviors and emotional patterns linked to addiction.
That scientific breakdown really helps in understanding its effectiveness. Are there any personal stories you can share about individuals transitioning from methadone to Ibogaine therapy?
Indeed, one striking story that comes to mind is about a young woman who had been on methadone for over a decade. She felt stuck in her recovery journey and sought Ibogaine therapy in Mexico. Through the treatment, she reported significant reductions in her withdrawal symptoms and a newfound clarity about her life and choices. The therapy not only helped her detox from methadone, but also provided deep personal insights, which contributed to her holistic recovery. She is now free from methadone and actively engages in a support community that sustains her newfound clarity and purpose.
That's an incredibly inspiring story. It speaks to the potential for transformation. However, are there any risks associated with Ibogaine therapy?
Yes, it's important to recognize that Ibogaine therapy is not without its risks. It can affect heart rhythms, so individuals must be screened for heart conditions prior to treatment. Furthermore, given its potent effects and the introspective journey it promotes, it should always be administered in a controlled setting with professional medical oversight. When these precautions are heeded, the therapy can be safely managed.
I'm glad we addressed the risks. It's crucial for anyone considering this option to be well informed. Could you share some insights from experts on the therapeutic process and the recovery journey with Ibogaine?
Certainly. Experts stress the importance of an integrated approach to Ibogaine therapy. It's not just about the detoxification that occurs during the treatment, but also about the preparation and aftercare. Preparing the body and mind is critical, as is establishing a supportive environment post-treatment. Therapists often recommend combining Ibogaine therapy with counseling and community support to maximize the benefits and ensure sustained recovery.
That holistic approach really underscores the depth of the recovery process. Can you explain how someone can access Ibogaine therapy in Mexico and what they should expect during the treatment?
Accessing Ibogaine therapy in Mexico typically involves connecting with clinics that specialize in this treatment. Prospective patients should thoroughly research clinics to ensure they have experienced staff and adhere to safety protocols. Once at the clinic, individuals undergo a medical assessment to ensure they are suitable candidates. The therapy itself usually involves a single high-dose Ibogaine session that spans 1 to 2 days, under strict medical supervision. Post-treatment, patients enter a period of reflection and analysis, often supported by therapists who guide them in integrating their experiences into daily life.
That's a comprehensive look into what to expect. Finally, what encouragement would you offer listeners who are considering alternative healing options like Ibogaine and seeking professional guidance?
I would tell listeners that exploring alternatives like Ibogaine therapy is a brave and hopeful step towards recovery. While it's not a guaranteed solution for everyone, it offers a powerful opportunity to break free from addiction when other treatments have not been effective. It's crucial to seek professional guidance, as this ensures the treatment is applied safely and effectively. With the right support, individuals can find a new path to well-being and reclaim their lives from addiction.
Thank you for those words of encouragement and wisdom. As we wrap up today's episode of Healing Horizons, we've delved into the complexities of methadone addiction and explored how Ibogaine therapy in Mexico is providing hope for many. Through our discussion with our expert, we've demystified the science behind Ibogaine and shared real-world stories of recovery. Our hope is that listeners feel empowered and inspired to seek new pathways to healing and transformation. Thank you for tuning in, and we look forward to bringing you more stories of hope and renewal in our next episode.